oxygen administration and suctioning. So, suctioning. For all of those of you who have done the tracheostomy, actually this is the continuation. Patients, once you do your tracheostomy care, okay, these patients, they will be like starting to have secretions. And secretions will be accumulated in tracheo down in the pipeline. Okay? The tracheostomy or the pipe within the tracheo. So what we need to do, once we see the patient requiring suctioning, so we need to do it soon. Okay? We will not wait for the nurses, or you do not talk to your nurse or inform your nurse that patient needs to be suctioned. So you need, upon your assessment, you need to suction your patient. Now, suctioning. What is suctioning? Okay, so you got it? So it is the aspiration, okay? Or cleaning, aspiration, yes. Aspiration, cleaning, withdrawing of secretions from the patient mouth, the nose, and the trachea. So why we are going to do it? Okay. Suctioning, okay, so it is the aspiration. When we say something, that goes with what we are going to do. Like suctioning. When you say suctioning, it's going to clean. Okay? So why we will suction? To aspirate, to clean. Okay? So why we do it? Number one, to clean the pipeway or the airway. To clean the tracheostomy or the nose or the mouth. And why we will do it is to give them a proper breathing. Okay, breathing. Because these secretions blocks the nose, blocks the mouth, and blocks the trachea. And these secretions also the same thing. If you will not remove it, your patient is going to die. Same thing, they feel like, according to those patients, when they are full with secretion, they feel like they are drowning. So, this is how we are going to rescue or to save our patient. So, why we will do it? To clean the nose, to clean the mouth, to clean the trachea from secretion, and to give them a good breathing. Okay, so, and to, of course, to keep the patient comfortable after. Although we irritate them by putting this, inserting the tube, but right after that, they will be comfortable. Okay? So next, so this is why we do it, and how we will do it now is we need equipment to do it. So what we need to have is a wall-mounted suctioning machine. Okay? And in that wall-mounted suctioning, we will be needing 2 of these suctioning connecting tube. Okay? This is connecting tube. We will have an appropriate suction catheter. So this is the suction catheter. Why I said appropriate means to say, for the babies, it will be 6 to 8. Then for the infant or the pediatrics, it will be 10 to 12. And for an adult or elderly, maybe 14, 16, 18, 20. The bigger size, the bigger, it requires for the requirement for the elder. Okay? So we have appropriate suction catheter. We'll be having a gauze. We'll be having a bottle of saline. And surely we will be needing a gauze. Okay? So when we come to the patient, we will be coming to patient with all of this. Okay? So as we know, our universal protocol, So, universal protocol, what does it start with?
Hand hygiene.
Hand hygiene. Next. Cups. Okay. Next. Yeah? What is that? Okay, introduce yourself. How you will introduce?
The name and the date of birth.
Introduce
You introduce yourself. Ma'am, I'm Oni, the CNA. I'm going to take care of you.
Okay, so introduce yourself at any time, okay? Whenever you come near the patient, you have to introduce. Not unless you are there assigned for the patient for the whole 8 hours. Okay? So what else?
Ask the patient.
Identify the patients by what? By 2 international identifiers. Asking the name and asking the date of birth. Next.
check for safety.
If the patient is unconscious, okay, you have to check the wristband. Or, okay, ask the relatives for the ID. So another one, if you are in the hospital or in a healthcare, you have to check the medical records number. Okay, if you are in the hospital. Okay, so what else? Safety of the patient. So make sure that your bed wheel is locked, your side rail is up on the other side and down in your side. What else? Privacy. If the patient are in 3 or 4 together, so you need to close the curtain. You do not expose your patient. Next, appropriate PPE. So how do we? What we say with the appropriate? How we are going to follow the appropriate PPE? By what? Based on the transmission-based precaution. What is the transmission-based precaution? Okay, so you know exactly what goes with those transmission. When you say contact, what you will use?
Gloves.
Okay, contact means contact. Anywhere contact, you need to use the glove. Okay, for your respiratory or the droplet, mask. Okay. For the airborne, airborne is mask. Okay. So as I said, you are not supposed to use your N95 not unless there is a fit test. Okay? Otherwise, you will be suffocated with that. Okay? So you know exactly how to appropriately use your PPE. Okay? So if you see that your patient is having such infectious disease, so use your PPE appropriately. Okay, so now we will go with our suctioning. So as I said, we have a wall-mounted suction machine. So we have to prepare first. You, as the CNA or the nurses themselves, they are the one preparing this. This one is in a pack of sterile. All of these are in a pack, like the sterile thing. Okay? So all this, you have to open, you have to. What we need to do, we have the wall mounted, attach this, one. Okay? Wall mounted, connect, and the end of this will go to a canister. Suction canister. We did not talk about suction canister. Where is my bag? I will just show you what a canister should be. Suction canister. Okay, so that for your wait. Suction. Okay. Okay? So you can see this is the suction canister or the jar or the bottle. Okay? So what we have the suction, wall-mounted suction machine. We have the suction canister, we are calling it, or the suction jar or suction bottle. Okay? So this is where your secretions are going in. Okay? So, once you see, if you prepare like this with a plastic, disposable plastic inside, that you have to dispose to the medical waste. But if there is only a bottle without the plastic container inside, you need to wash it, throw those secretions and that content inside of the toilet bowl, and flush it and clean the bottle. Okay, there are two ways. Okay, you do not leave. When you are leaving after your duty, you do not leave anything that is dirty in your unit. Okay, make sure that everything is clean. Now, as I said, this one tube, one connecting tube to the wall mounted. Okay. The end of this to this. You see that there are two. Okay? One should be connected to the other canister. Okay. Now, next, we need another connecting tube. Connecting tube from the canister to the suction catheter. Okay, suction catheter should come out like this, the same. It will be coming from sterile pack. Okay? Any sterile pack, take off like this and connect it to the tube. So remember now, we have two connecting tubes. One tube from the connecting from the wall mounted to the canister. Another tube from canister to the suction catheter. Okay, got it? Okay. Because we are going to prepare this, not your nurses. Okay? So assuming that it's already here, we will suction our patient. So whenever we suction our patient, we need a glove. Okay? So we will use a glove. This is just disposable, so you can just wear it at any way, anyhow you wanted to wear. Okay. Open up your saline. Take off the cover, set aside. Now, hold this like this. Okay? Roll it in your hand or in your finger. So, this connecting tube, suction connecting tube, has an opening here. So, this one, we will use it when we put our finger, it means close to suck. Okay? That's why suck out. Whenever we put suck out, suck out. We will do it as fast as we can. Okay? Not, put your fingers there in 1 second and then all of this will be out. Okay? What we need to do now, as we open, dip Okay, I did not put my finger. Dip, close. Suck out, suck out, suck out. Okay, this is how we test it, whether our machine is working well. Okay, now, sorry. So we need to put it in 1. In that gauge, 1, 2, 3, 4, 5. So the minimum is 1, set to 1. Okay, so the pressure of the gauge is set to 1. When you put to 3, 4, 5, it will be higher. Okay, so set to 1 or 2, but set to 1. Put it on, set to 1. Get your suction catheter, roll it to your finger, dip to test, and close, suck, suck out, suck out, suck out. Go to the patient, to the tracheo, insert, suck out, suck out, suck out. Go back to the saline to clean. Okay? Suck in, suck out, suck out, suck out. Back to the tracheo, suck in, suck in, suck in, or suck out. Back again to clean. You will find that the secretion is coming out and going to the canister. Okay? So, now we will go, we saw the mouth is full also, so the same catheter. You can use it inside the mouth. So insert, suck, suck, suck. Go to the saline, suck in, suck in, suck in. Go to the mouth, suck in, clean it, dip, suck in to the nose. You can dip around 4 to 6 inches. Okay? So you can dip this much. Okay? The same, clean, suck in, suck out. Done. Okay, so we are done. Patient is okay. If there is anything from the mouth or the nose, so clean the patient with, okay, the gauze. Disposable. And what we need to do here, put it back to the suction pack. So either you put a plaster in here, and this one will go inside of that. There is a cabinet, bedside cabinet, inside of your bedside table. Okay? And the things here, the remaining saline solution, you do not throw it. Okay? This all goes to your disposable medical waste. And these two will go on top of your bedside table. Okay? Then take off your glove. Take off. Taking off the glove from the middle, out. Clasp it with the 2 fingers, roll it out, and to the medical waste. Okay, now, hand washing, hand hygiene, go back to the patient. Keep the patient comfortable and document. Next, we will do our oxygen administration. What is oxygen? Is the air we breathe. We breathe. Okay? So oxygen is the air we breathe. So oxygen administration is what? What is oxygen administration?
The provision of oxygen to the patient who cannot breathe normally.
Yes.
Enable them to breathe.
Providing oxygen to the patient.
Provide oxygen to the
Okay, so providing oxygen to the patient. Why?
To enable them breathe normally.
Okay, not normally because they are with disorder or something. Okay, so to provide oxygenation. Okay, so good airway, to provide good airway, to provide good oxygenation, and what else there? why do we give oxygen to the patient? What are those with the patient? What are the condition of the patient? Why we need to administer oxygen?
The
Why?
patient have the
We are administering oxygen for those patients who are having difficulty of breathing. So what is the medical term for the difficulty of breathing? Dyspnea. Okay? So the patient has shortness of breath, the patient has difficulty of breathing, or the patient has a disorder or disease that requires oxygenation. Okay, so what we need to prepare, we have the same, the wall-mounted oxygen machine. Okay, the same way there is a gauge, 1, 2, 3, 4, 5. But here in the oxygen gauge, there is a corresponding amount of oxygen that is to be given to the patient. That's why we will be careful. It's not only that why we wanted to give is to give. No. Because the patient requires such. Okay? Like for example, 1, when we set to 1 means at least, if I'm not mistaken, 20 to 40 liters per minute. That is the oxygen to be delivered to the patient. Okay? So it depends to the doctor whether what is the gauge required. But for us, since the patient, we had the tracheostomy care and we have done our oxygen suctioning. So we have seen that our patient is becoming bluish or there is a mild difficulty of breathing. So we need our response or our treatment is to give the patient automatically 1 liter of oxygen. Okay? So oxygen administration, wall-mounted oxygen machine, we will be having oxygen face mask. This is for adult. You can use it for adult and the elderly. Okay, so there is a tube. Connect this tube. Okay, so this is face oxygen mask. Connect the tube. Put onto 1. How to test? As we said, never do or give anything to the patient without checking. So we need to check. How to check it? Put it on,
To the cheek.
okay, to the cheek
Or
or
face.
to the skin. So you need to feel something there. Okay, we are giving medical gas. Medical gas, as we said, to provide oxygenation. So, check. Now it's okay. So we will put to the patient. The patient has trachea. Tracheostomy. Okay, sideways. Put it covering the down of the tube and to the chin. Keep it to the patient's over the ear. Adjust it. Okay, and leave it there. Now, if the patient don't have tracheo, so we will put to the face. This is the most common, the normal thing. So you must see to it that down of this mask is hugging the chin. Okay? And this upper part, there must be something like a metal part, like this. Okay? So metal part should hold the nasal bone. Okay? So that to prevent the oxygen from leaking. So same thing, over the ear, adjust, and keep for the patient. Okay. Next, we will be having, this one is for pediatrics. Okay? Normally for the baby, we will be using the nasal prong. This is pediatrics, but for the baby also, we can use it. This is the normal one. Now, we have the other type. We have the oxygen, the nasal cannula, or the nasal prong. Okay? P-R-O-N-G. Okay? So, same way, attach it, connect it, set to 1, and, okay, let the patient, okay, fix it at the back, over the ear. If this one is rolling, so we will put a small piece of plaster here to keep it secured. Okay, so it will not be rolling like this. Okay, so keep it here. Now, if we are going, if the patient is asthmatic, we will be having a mask with nebulizer. Okay? That nebulizer has something like a cup in here. So the doctor will order some medicine to put in the cup. Okay? Same thing, we will be connecting 1 or 2, it depends, and how to test it, you do not put it here. Check for the mist. Mist is something like a droplet coming out from this. Okay, just check it like this. Do not do like this. Okay, just check it and it will be like functioning. Okay, that's the time. Same thing. Put it to the mask, to the trachea. Okay, covering the trachea tube and to the chin, or else to the nose, from the chin to the nasal bone, or with we will not be using the nasal prong. Okay, so only these two. Okay, so what we have in our oxygen administration, we have 3. Okay, the normal one, or the normal oxygen face mask, and the second one is the oxygen with nebulizer, and the third is we have the nasal catheter, or the cannula, or the nasal prong. Okay, so what should be the oxygen saturation for our patient? 95 to 100. Okay, so by the time, check for the oxygen saturation of your patient. Okay, so only then, whether that it will be around 95, 95 or 100, so it is time for you to take off your oxygen. Okay, so same way, so whatever did you use, so throw it to the medical waste, come back with, hand hygiene, and come to the patient and document what you have done. Okay, document everything. How did you observe the patient? Patient is very dyspneic, so requires oxygen administered 1 liter per minute, and patient was relieved. Okay, so this is all our suctioning and oxygen administration.
Easy to attach the
Okay, if there is any pipe, it is not ours to do it. It will be the nurses, we will be assisting them. Okay? If the patient is with a permanent tracheostomy and the patient is unable to, there is a ventilator. We have the CPAP, or the mechanical. What it means to say, there is something like oxygen, but that is regulated. Okay? So it is not for us to regulate. It will be the nurses or the respiratory therapist. That is not us. So for us is assisting what is the simplest and the most common. Okay? When the nurses ask you to assist them, that's the time they will be the one to guide you what to, how to. Okay? But for us, we are not going to touch it from here. Okay? So there is another mechanical ventilation or ventilator, whatever. Okay? That will be a little level up. Okay? Not in our scope. Okay then? Any question? Question. I like to answer question.
Attached behind because maybe the patient is lying on it, we might obstruct the flow of oxygen.
No, it will not. Why? Come on. Why not? What I said not, it's not going to choke because you are not going to put it down here. Nobody will choke from the back. The choking is from in front. Okay, that's one thing. And this thing, you are going to adjust it over the ear and adjust at the back of the head. So it's not going to touch the nape or even this one. There are some people who are using this in front.
Around the ears underneath the front.
Okay? So, as you said, there is a possibility of, because it is in the throat. Okay? So, better use it at the back. So, more safer if you are going to use it at the back.
I have a question. So sometimes we give this oxygen, but the patients don't have this tracheostomy here. Sometimes they don't have, but we'll give just from the nose only.
It doesn't matter whether they don't have or they have. So we will put it according to how they require. They require only here, put it here. If the doctor said, okay, just put it. If the patient, there is an orogastric, so there is already a tube in here, so use the nose. Okay? You do not make it two here. Okay? Where did it went?